Where in the body is MDS found?
Myelodysplastic syndromes are a condition that occur in the bone marrow. And this is how I think about the bone marrow. The bone marrow is the factory that makes all the cells that wind up in our bloodstream. So it makes the red blood cells, those bring oxygen to our tissues, and when those are low, we're anemic. It makes the white blood cells, that's our immune system that fights infection, and it makes the platelets that help stop bleeding. So when a person has myelodysplastic syndromes, the factory's broken. It's not making those crucial red cells, white cells, and platelets that we need to survive.
How do I become more knowledgeable about MDS?
Studies have shown that educated and empowered patients often have better outcomes. HealthTree University is the first and only free, comprehensive curriculum for patients and caregivers. Create a free account to gain exclusive access, where you can watch our newest unreleased videos, easily explore topics through our organized courses, and assess your knowledge with interactive quizzes. Visit HealthTree University and become an empowered patient today.
So MDS is now classified as a cancer of the bone marrow. And being a bone marrow and blood disease, essentially, it really is all over the body, even though the source of the problem starts in the bone marrow. It affects you by lowering your blood counts, which makes you more prone to anemia-related symptoms such as fatigue or even heart problems. In older patients, it might make them dizzy, lightheaded, and cause all sorts of associated complications. It can lower your platelet count, which makes you much more prone to bleeding. And it lowers your neutrophil count, which is an important infection-fighting cell, so your immune system is very compromised. So MDS is a disorder of the bone marrow, and it is a cancer of the bone marrow, where unlike acute myeloid leukemia, where there are these rapidly proliferative cells in many patients, it is actually that your marrow is unable to make healthy cells. And this leads to complications related to having low blood counts in particular. So the key effects that this disease has are cytopenias, most remarkably anemia, and most commonly anemia, which can cause a whole host of side effects in the body, including fatigue, shortness of breath, heart issues, falls in elderly patients, all that are associated with an increased mortality. Other cytopenias include thrombocytopenia, which is low platelet counts, which make patients more prone to bleeding. This is less common than the anemia, but also happens quite frequently. And the third important thing is neutropenia, which is a type of immune-fighting cell, which can cause increased risk for bacterial infections, and more specifically, fatal bacterial infections. So this is quite a serious disease, and even though historically there was some debate of whether this is a cancer or not, it is a cancer. In addition to that, it also has an increased risk of progression to acute myeloid leukemia, and that's another factor to discuss and counsel patients about.